All right, welcome. WJWC 97.3 FM The Heat, Grand Rapids' new multicultural radio station providing a multicultural playlist. Today we're interviewing Dr. Alejandro Quiroga, who is the president of Corewell Health, and Matt Johnson, who is the public relations specialist for American Heart Association in West Michigan. Thank you, Dr. Quiroga, for taking of your valuable time to be with us and to address our community, the bilingual community, and the BIPOC community of Grand Rapids and surrounding communities, to talk about Move More Month, April. I guess April has been designated as Move More Month, and perhaps you could tell us a little bit about how important it is for our community to engage in walking and moving more. And then the second part of that question is, how serious is this issue for our general health?
Well, Jose, thank you very much for having me. And this is an amazing meeting already. I love how we were just talking before we started, and Jose goes into radio voice, and such an amazing voice that you have there. I usually hate my voice, but I love the message that I'm trying to carry today. And it is that walking and physical activity is important. We've heard people say that, but I think we miss what we're trying to do and how easy it is to accomplish it. When you think about being sedentary, people not doing enough exercise, it's the majority of Americans, actually 1 in 4 Americans are struggling with this. And it will just take 10 to 20 minutes of walking to improve just significant health outcomes, just cardiovascular events and mental health. It has so many benefits for us.
Well, when I think about that, when you mention that, I think right away, oh, he's talking about me, because I'm sitting down a lot during the day, and so I think, like most Americans, we do have to recognize that we're under a lot of stress. We're sitting, there's so much to do and so little time to do it, so much on our radar and our checklist of things to do. So we need to be a little more sensitive to moving, you're saying, and to try to combat some of the ill effects of not living a movement lives, or a life centered on movement. That we're sedentary, meaning that we're kind of laid back, sitting down, more in a stressed environment all day. The American Heart Association Executive Director recently, Jana Saminsky, recently said that it's important for communities to come together and to take steps, or big steps or small steps, to improve the health of their communities. What role do you see Corewell Health and other community organizations playing in this goal of creating healthy lifestyles? And then what suggestions could you give our listeners to improve their overall health?
It's a great question. Just like our daily life is about partnerships and connections, I think organizations connecting for the greater good of the community is a key objective. And we're big partners with the American Heart Association. They are celebrating 100 years of life-saving work. They do a phenomenal job. And in Corewell Health West and Corewell Health overall, we are very invested in preventive health. We're very invested in lifestyle medicine. We have an amazing primary care team who is dedicated to make sure that you can function at your best. In case that's not the case, if for whatever reason that will not happen, if you have a heart attack, if you have a stroke, if you have one of those events, we have great hospitals. But our goal is to keep you away from them and healthy, serving the community. Hopefully, you say it feels like we're talking about you. That will never be the case. We're going to get you to walk. We're going to keep your voice going through the airwaves for many years to come.
There you go. I'd like to be at least 90-something, and before I turn in my keys here. But thank you, Dr. Quiroga. We have Matt Johnson, and maybe Matt, your position with the American Heart Association.
I'm Communications Director here in
Communications Director.
Thanks for having us both on.
All right. And Matt, could you describe some of the events that have been orchestrated, organized? I know you had the big day for Move More Month. It was a Move More Month Day. recently. Maybe you can talk a little bit about that, and then maybe some of the upcoming dates that you have yet that are planned.
Yeah, so as Dr. Quiroga said, it's really important that we all partner together, and this is a community-wide issue, right? It's important that everybody gets exercise, and so we're encouraging all of our supporters to get their companies together, to rally together, to take a walk with your company, get outside, get that 15-20 minute walk in with your colleagues, take a conference call on the go. Dr. Quiroga, I know we've seen you take a video out to go and see you out walking, and it's great to see you do that and you sharing that on social media. Things like that are really important. Earlier this month was National Walking Day, which was April 3rd, which was a day where we encourage people to share photos of them getting out and moving, hopefully spreading that awareness on social media so people see other people doing it and they will join the movement. But we really want to celebrate that all month long here in West Michigan. It's not just about, that week that was spring break week, but really all month long we want to be doing this. So we do have events on April 19th, April 23rd, and April 24th with various other sponsors and partners of ours to get companies involved. So we encourage people to get out and get moving. We have one in the Grand Rapids school, which will be really fun to get kiddos out. Sometimes it can be as simple as getting your kid or your dog out for a walk and taking that extra, walk from the parking lot. Instead of parking right next to the door where you have to go somewhere, park a little further away. It can be, taking the stairs versus the elevator. Some of those simple things you can do for your health, we're encouraging companies to do as well. And so that's what those events throughout the month are really about, is encouraging people to start taking those steps.
Awesome. And could you add anything to that, Doc, from a medical perspective, activities that perhaps might promote wellness and movement that our listeners could engage in for the benefit of their own health improvement or our community in general? Maybe it's a community-wide event.
Well, I think there's many points to make there. And first of all, please feel free to call me Ali. I don't like to go by Dr. Quiroga. But I want to highlight one of the days you didn't mention, because it's on April 24th at 11:30 a.m. You're going to be working with Priority Health, which is part of us. Part of Corewell Health is that's the insurance arm. And Priority Health has done a phenomenal job in preventive medicine and preventive efforts in the community. So that is an important key. The other part is not only about exercise. If you think about what the Surgeon General has called out, isolation, human isolation is one of the biggest public health problems that we have in the U.S. And so when you combine some of the solutions, go walk with someone. Go reach out to that friend who hasn't gone on a walk for a long period of time, and just have a little walk with your friend. Then create that connection. You're solving for isolation. You're solving for exercise. There's many things. You can take the stairs. We take the car for everything. Just go outside. It's interesting. The majority of solutions for some of the current issues in our society will be fixed with such simple solutions. We just need to get into a different mental framework.
It's so true with all of our technology and whatnot. We are fairly isolated. Don't even talk with family these days. It's mostly texting and whatnot. So I think you underscore a very important point there. Are there any resources, Matt and Ali, that you would suggest for our listeners to get more information, maybe get some tips and information about getting healthy and staying healthy?
Yeah, the American Heart Association, we are a resource-rich organization, right? So much of what we do is providing resources to the community to help educate and make them aware of these important health topics. There's a great website that's very easy to navigate, heart.org/movemore. There are a plethora of resources there. We have information about, when to fit in your walk. Is there a good time of day to walk? We have graphics that can be shared with schools and young children and companies to encourage, just those simple things that we talked about, emphasizing them in a visual way that's easy to understand. Things you can share on social media, we also have available there. And then just our overall recommendations for physical activity. Some of the things that Ali mentioned and that you mentioned, Jose, you'll see on that website, just kind of reinforcing that education and awareness piece. So it's all on heart.org/movemore.
All right. Is there anything else that you'd like to leave our listeners with so that they can improve the health conditions and engage our community into creating a better health environment for them and results or outcomes in English?
Absolutely. I mean, a few things. First, Jose, I hope we convince you in the next interview we're going to be walking. That is a challenge for you.
It is.
And then we'll do it in Spanish if you want the interview, but we'll be walking to model for our community what we need to do. And after like a year, we'll probably do one with a little jog. Maybe we can get you there.
I have to check my physical first because that's really important at my age. You know,
you look plenty young, Jose.
Oh no, that's plenty young is a perspective. But
and we have an amazing primary care team that can see you at any point.
Excellent.
And we're happy to hook you up. But just really, I mean, think about it. It's a positive outlook. You have to, the solutions in life are very simple. You have to eat well. It's not always an easy thing to do, but you have to be intentional about it. You have to exercise. All of those things will help you with your mental health. You have to connect with other humans. That's going to help you feel less isolated, improve your mental health, and be more engaged with your own body. Those are not hard messages. It's hard to do them. I run almost every day. I feel very passionate about it. I will not be able to run a healthcare system if I didn't run myself.
There you go. It was very, very important. I was wondering, Ale Quiroga, that we have a Spanish-speaking audience. We're a BIPOC-centered, very focused radio station, and then we also publish the Community Voice Levels bilingual magazine that's distributed statewide. Wondering if we might be able to flip in Spanish real quick and just give a little recap, not a long interview, but a recap. What advice you would give to our Hispanic community? So, if you don't mind, we'll flip the script into Spanish.
Of course.
Así que estamos hablando con el doctor Alejandro Quiroga, o Ale, es el presidente de Corewell Health. Y bueno, primeramente nos da mucho orgullo saber que usted está encargado de Corewell Health, que antes era Spectrum Health, pero reconocido aquí en Grand Rapids como el hospital mayor y más favorito de la comunidad. Es el hospital que me presta servicios todo el tiempo y me encanta este lugar. Si nos puede dar, por ejemplo, unos cuantos sugerencias de cómo nosotros podemos vivir una vida más saludable y participar en este evento y todo el enfoque de abril, del mes de abril, en mover más y tratar de superar nuestra condición de salud.
Bueno, José, muchas gracias por tenerme acá y me encanta representar a la comunidad latina, me encanta hacer estas entrevistas en español y estamos a su servicio con respecto a nuestros hospitales. Espero que todo esté bien contigo. Mencionas que utilizas nuestros servicios. Y cuando estuvimos haciendo la entrevista en inglés hablamos de que te podemos entrar con cualquiera de nuestros médicos en cualquier momento. José, la Sociedad Americana del Corazón está haciendo esta campaña para que nuestra comunidad sea un poco más consciente de la necesidad del movimiento. Somos una comunidad sedentaria, 1 de cada 4 americanos es sedentario. Y esto causa una cantidad de problemas, como problemas cardiovasculares, problemas mentales. Estábamos hablando bastante del aislamiento, que es un problema de salud pública muy grande ahorita en Estados Unidos. Y la mayoría de estos problemas se solucionan con movimiento, caminar más. Solamente 10 minutos a 20 minutos de caminar en el día puede mejorar la situación cardiovascular para la mayoría de americanos.
Está bien, gracias. Son buenas sugerencias y espero que nuestra comunidad se aprovecha de la información tocante crear mejor salud entre nuestra comunidad. Y aquí tenemos a Matt Johnson también. Matt, the site that we go to for more information. El lugar donde vamos a más información en el website.
heart.org/movemore.
Así que es heart.org/movemore. Gracias por la entrevista y yo reconozco que su tiempo es muy valioso y tiene bastante valor, así que gracias por estar con nosotros hoy día.
Un placer, José. Yo pensé que Mari iba a contestar en español y yo ahora sí que no sabía. Nada, habla español. Buenísimo.
Okay, thank you, and we wrap up our interview with Dr. Alejandro Quiroga and Matt.